Hello and welcome to Coronavirus Report. We're here with Pastor Stephen Bohr, the president and speaker for Secrets Unsealed, our chief resource person, Dr. Milton Teske, who is our board chair, who is the health officer for Kings County and has many connections with CDC and other organizations that sort of keeps him on the front edge of the information, and that's what we're here to give you. And I'm C.A. Murray. We're glad to have you with us, and hopefully today we can inform you and help you to stay healthy and free of the virus, and let you know how you can walk your way through and do well during these troublous times that create so much mental and physical stress on all of us as we're trying to stay healthy and trying to stay well and do our jobs. Gentlemen, good to have you here.
Good to be here.
And Pastor, we'll let you lead off because I know you've got a lot to say. I've got a list of questions here. And then the good doctor came with an armload of information.
Too much for one program.
Indeed.
Okay, I just want to start, Dr. Teske, by asking about the percentage of individuals that have had to go to the hospital and have been on respirators about pre-existing conditions. Is the greater proportion of people who are going to the hospital and on respirators, is it because they have pre-existing conditions? And how does that impact?
Yeah, if we looked at, we just got the statistics out of New York recently, and in New York, 92% of those hospitalized also had obesity or diabetes or hypertension or coronary artery disease or some of these other what we would call metabolic syndrome type diseases as well. And so it's the thinking is you add these on top of that and we're going to really get in trouble.
So how does it work physiologically? What, is it because the immune system is weak that the virus is able to do more with people who have pre-existing conditions, or?
Last time we talked a lot about the immune system, and that's certainly a role in there, but there's something new that's coming out now that's showing up in what's going on here. Doctors everywhere are starting to realize that these COVID patients have problems forming blood clots. They're making clots when they shouldn't. They're making clots in little arteries where there's not supposed to be. You may have seen just this week on the news, there's a whole slew. They've realized otherwise young, healthy people were getting strokes. Well, what is stroke? Stroke is a blood clot that is formed in the brain and block the brain, and now you've got a stroke. So, and we're seeing that, was surprisingly, even in young people which didn't have underlying artery type disease.
More than usual?
Oh yes, yes. One of the persons said their number of stroke patients has doubled in that they would typically have. You know, normally we always have people that are getting strokes because of they've got bad arteries and stuff. It's one of the things that happens here in America. But now we're getting twice that many. And among them are something that we very rarely see, which is young people with strokes. Usually people, I think the mean age there, the median for strokes is around 72. So, you know, half your people are over 72, half under, but that's sort of the middle of the pack of where you see people with strokes. And now we're seeing 30-year-olds with stroke, 40-year-olds with stroke, 50-year-olds with strokes. And so the virus is causing, we don't understand totally exactly what it's doing, but it has to do something with the endothelium, the artery wall, and it's breaking down and it's forming blood clots in there. Now, if you think about it, this is sort of the opposite of some of our more other recent ones. Ebola was a really bad, thing going around, and it had the opposite. We called it a hemorrhagic fever because it caused blood not to clot, and people would start bleeding out everywhere. Well, this is the opposite one. So the doctors are realizing now that they start anticoagulants fairly early in these patients. And they will move on to the various, clot dissolving drugs for strokes. And by the way, any of you who are, watching this and want to, have someone that or you should get what might be a symptom of a stroke, don't put it off or ignore it. what are the symptoms? Well, you get numbness or deadness, in one side or one arm or one spot, or you get some paralysis or sudden weakness in one side or one part of the body, or loss of speech, or the speech becomes slurred. These type of things that would be warning signs for a stroke. You want to immediately, call 911, get into a hospital emergency room, ideally at a hospital that specializes in some type of stroke care. Most hospitals now are starting, or at least many are starting to develop, they have code stroke. And if you come in with the symptoms of the stroke, immediately you go straight to the CT scanner. They scan to make sure it's not bleeding, because we can't give these drugs if you're bleeding. We would make it worse and you bleed out, and that's usually fatal. So that's the first thing that'll happen. And then, even before you get your vital signs, they're going to scan you. And then they do the other preliminary stuff, so that very quickly we've got enough information to go ahead and say we could use TPA. It's a substance, a drug that we will run in the IV, and it will cause clots to dissolve. And if we get this very early on, frequently we can dissolve that blood clot and open it up and allow the blood flow to return, so you don't get a permanent deficit, a permanent stroke from this. And in centers that have the ability, they can go in with interventional radiologists, go in with a catheter. They go up through the arteries and they go right up into the brain. And if it's a large clot blocking off one of the major arteries, and by the way, many of these we are seeing in young people are big vessel disease. The middle carotid artery is clotted off, and a whole half of the body's paralyzed and you can't talk, type of thing. But they can go up, and on the end of this catheter they've got something that's a little bit like a corkscrew in a cork, and they can thread this in and attach it into the center of that blood clot, and then they can gently extract and pull it back out and back it back out of the area where it was clogged up there, and open that up. And they are doing those, within 3 hours we get excellent results. They may do them within 6 hours. I think the cutoff is around 24 hours. By then it's really too late to do anything.
Now, doctor, you say excellent results. The effects of the stroke can be reversed, or they're not doing that much damage initially, or they can actually reverse the effects?
No, in other words, when the stroke forms and suddenly things don't work, because there's no blood flowing to those cells.
Okay.
But now if I pull the clot out and blood starts flowing back there, well, the cells weren't dead yet.
Okay.
And they can come back to life. Now, the longer we wait, the worse the damage, and the farther we move down that road, we're less and less likely to get as much back. So, if you should get, stroke symptoms, or someone or is getting strokes, immediately get them into one of those centers, so this can be, don't wait and say, well, I think it'll go away, it's probably nothing. No, go in now and let's find out, because they can also expand. One of the doctor was describing, he was going in with one of these to, they can watch it on the screen right here. They can see where the clot is and where the blood vessels are. And while they were extracting this clot, they're seeing a little clot form over here and another one form over here. And there's apparently this clotting is going on in multiple places at the same time. Some smaller, some less, some bigger, more, but it's a really serious problem there.
Just a follow-up question. I know CA has lots of questions, but I've heard through the grapevine that the 5G network might have something to do with it. Is there any truth to that?
Well, we all know that electromagnetic radiation is not good for the human body, and lots of it is worse. And of course, the 5G is really, really more radiation that's being put on the human body, and it does damage cells and it can cause problems there. So I think if we add that on top of all of these other pre-existing conditions, and now we've got a virus in there, it probably can contribute to it. I don't quite go all the way as some theories would, some of them, maybe we call them conspiracy theories, that say, oh, this is all just caused by 5G. It's not really a viral problem at all. It's not a virus. I think we've got a real viral problem. I mean, we know what it's doing to the T lymphocytes, and now we're finding what it's doing to the clotting mechanisms there, you know, in addition to the other viral destruction it's doing in lung tissue and stuff. So I think we've got a very real viral problem with or without the 5G. But 5G definitely won't make it better. More electromagnetic radiation is going to be bad for us all the way around. They put 5G in the big cities because you have to have, it's a short range, and so you have to have these high intensity towers, but you have to have a lot of them dense real close. So they put those in the big cities. They don't put them out in the smaller towns and villages and countryside. They use the other cell phone range, and probably will permanently. You're not going to get 5G out in the country ever. Nobody's going to take the trouble to put that many towers out there. But then again, we've been advised to get out of the cities and live in country places. So, there may be some electromagnetic reasons for doing that, as well as social reasons due to the environment in the city there.
We might have to get
away from the
some
big cities.
satellite internet.
Yeah. Yep. I can tell you, living in the country, getting good internet speeds is difficult.
Yeah.
Difficult. But going back to this clotting here, we're realizing that it explains a lot of the other things as well. Now, we started off with our understanding of this coronavirus as being a respiratory virus, and people become hypoxic. Their lungs fill up with these, what they call ground glass opacities. It's the way they look on a CT scan. And that became the real classic finding, this CT scan with all of these spots of whited out lung and the hypoxia and respiratory failure. And we try to put people on ventilators to keep them alive, and they still would get worse and die. And some of it is just straight pneumonia because the virus is attacking that respiratory epithelium and causing it to break down. But interestingly, what we're beginning to realize now, that much of what we've been seeing going on in the lungs in these CT scans and the hypoxia and stuff is not really pneumonia as it is pulmonary emboli. In other words, these little blood clots that are forming on artery walls and jamming and clogging up things, if you block up the blood vessels in the lung, a few little ones or maybe some bigger ones or whatever, but as you block up little vessels out there, what happens? Well, even if you're breathing air through that part of the lung, if blood's not flowing through it, then you're not oxygenating blood, and you start to get less and less oxygen out of each breath because you're only passing a little bit of blood through part of the lung. And so hypoxia, and which is one of the key findings. And interestingly, one of the things that the ICU doctors tell us about what's going on in these ventilator patients is they're different than typical pneumonia patients in how they respond on the ventilator. Pneumonia patients, as your lungs fill up with pneumonia fluid, the ventilator's got to work harder and harder to try to force more air into those fluid-filled lungs. We call it lung compliance. We got to work harder and harder. The lung just doesn't freely expand, and we can't just freely move with the air. What they're finding, these coronaviruses, many of them have real good lung compliance. In other words, it's like very low pressures, and the lungs ventilate just fine. We're moving air really good. The problem isn't that with moving air, the problem is the blood flow, the clots, the emboli from this clotting mechanism where the blood is clotting where it shouldn't and when it shouldn't in there. And as we clot up those spots, the more and more you clot up, the more hypoxic you will become. And in spite of all the ventilation, you're not going to survive. I saw one statistic that said those that ended up on a ventilator, 88% of them did not survive.
Wow.
There was at one hospital, I forget now which one that was, but that type of numbers, you realize something really bad is going on there. And it's appearing that it is in the blood vessel walls. Now, if you put that together with what we mentioned earlier about pre-existing conditions, you know, the obesity, diabetes, heart disease, high blood pressure, all of these typical, we would call them Western lifestyle diseases that come from eating like we eat here in America. One thing all of these have in common is that these disease processes affect blood vessel walls. You know, the wall of our artery has a very special little layer on there called a glycocalyx that protects the surface of it. And this glycocalyx has in it special things that prevent blood clotting. Because ideally we want the blood to flow really nice through our arteries and we don't want it to clot. And so all these things are built in there to help prevent clots forming when they shouldn't, so we can keep the blood flowing really good through there. But one thing these diseases have in common is they break down that glycocalyx. We spend a whole hour on that in one of those other lectures you can watch. But the glycocalyx will break down like in diabetes, because the sugar will break down that glycocalyx. And as we break that down, now it's very easy to form a blood clot on there, because all of these things that would have protected it and prevented it are stripped away and they're gone. Arterial sclerosis that causes high blood pressure and that causes you know, the heart attacks and things where we build up these cholesterol plaques and you break down the glycocalyx and it allows these to form. And so if we're developing those, then we've probably got a bad glycocalyx. We're probably set up for that. And the glycocalyx also helps, it actually becomes, it's like a little, with each pulse of blood, this glycocalyx sort of moves, sort of almost like seaweed with the surf as it goes back and forth in the waves. Well, with each pulse of blood as that moves, the base of the glycocalyx is actually hooked up to the enzymes that make nitrous oxide. Now, nitrous oxide is real important to be made there because nitrous oxide's job is to relax artery walls. It's sort of the counterbalance to adrenaline, which comes through the nerves, which says constrict, because we're always constricting or relaxing to control the blood flow through our body. And so it's the adrenaline that's coming through or circulating from stress in our body that causes constriction. But then we balance that as you let up on that, and the nitrous oxide will relax it back up. But now we strip the glycocalyx off, we can't do that, and it's a major contributor to high blood pressure. Again, all of these different metabolic diseases seem to affect the artery walls, and we've got in common that we are destroying some real protective mechanism there. So as we've got that, and now we add a COVID virus that in some way attacks that artery wall, we're wide open to that attack and we're not going to be safe from it, and we're you know, likely to go on with more serious complications. I mean, why is it that age seems to be one of the factors? Because in America, as people get older, they get worse and worse arteries. It's pretty much almost universal in the United States. But, you know, the good news is that we know how to prevent that problem. Yep. Do you know we can restore that glycocalyx with a healthy diet? Three things really that we know destroy the glycocalyx. Number one is smoking. You know, if you're a smoker, you've wiped out your glycocalyx, you're at really high risk. Sugar and oxidized fat. So fried foods, high sugar foods, and smoking are the really big things that wipe that out. But if you look at everything we know about high blood pressure, about heart disease, about type 2 diabetes, you know, we're talking about simple lifestyle things. The same thing we always talk about, a whole plant food diet, not eating a lot of sugar or fat or all of this stuff, and then you'll have a healthy body, healthy thing, and you'll be set up to be protected from this. And you know, God's given us the health message for a reason.
Yep.
You know, he's promised to protect us from these plagues, but that protection comes in the context of obedience to his word. And as his word, he's told us all of these various things that make for good health. And the most simple one is come back and eat fruits and vegetables and all of that stuff. And we're being protected from those things in that way.
It looks as though we want to just find a pill or something that will allow us to continue our lifestyle, yet fight for us, so we don't have to fight, and rid us of this plague, while we can go on killing ourselves basically with our knife and fork.
Yeah, I mean, if you just listen to the news, everybody wants a pill and a test for the COVID. They want the test to know what thing, and they want the, you know, various pill or a vaccine to prevent it and save us from it. I think, you know, we're not going to get there with the vaccine as much as we had hoped. There's new strains out there, and as there is multiple strains, well, now how do you get the vaccine, one vaccine to work for all the various strains as this starts, you know, dividing up into various different strains going around. So I think we're going to find a lot less protection out there.
One of the things, you know, every week you come, you bring us new information, and our, you know, we're learning. I think one of the things that we can safely say is, if you have a weakness, if you look at this as a battle between two armies, this virus is very opportunistic, and if you have left a door open or a gate open or something ajar, it's going to find that and then make its entrance through that. And of course, if your lifestyle is such that it's tearing holes in your armor, as it were, it's going to find that weakness and exploit that weakness. It seems like it's very, very opportunistic, and whatever you got that's pulling you down, it's going to find it and make opportunity from it.
Yeah, I think that's exactly what we're seeing. I mean, if you look at who gets sick, those which we know have lots of holes in their armor from the various other disease processes out there. Another thing that's been in the news a lot this week is the serology testing. This testing for antibodies. And boy, if we get antibodies, then we'll know who's already safe because they've got the safe antibodies there. And if we could just do it, and then the CDC and everything is coming out, whoa, but yeah, we've got all these tests that tell you if you got antibody, but we don't know if that's going to give you immunity or not. So we don't know if you can use that test. So they're not letting anybody use that test yet. They're doing it for some population studies, but they're not really letting the test out there. Eventually it's going to get out in some form or way. But the interesting thing is, well, the same test, they said, well, we can't really tell if you know, who's safe or who's not by this test. And we probably won't ever be able to tell. Yeah, it was in the same little speech there that they said, we're going to have to wait to get a vaccine. But now, if they're saying that being exposed to and being infected with the coronavirus doesn't give you adequate immunity, which is usually the normal thing. We've already got, so to speak, the best vaccine. You've got the whole live virus vaccine. Oh, but we can't tell, you know, we don't know if you're safe after that. How are they going to come up with a vaccine, which is going to be based on pieces and parts of the virus there down the road, and, you know, injected with other things that flare up the immune system and to protect you? So they're really seeing two different things right here. And you know, in the news today, a lot of times the truth behind what it is, or what is the other agenda, what's the other motivation, what's the other, you know, see tremendous pressure towards vaccine, get these vaccines, we're going to do this. And I'm not sure those are always in the best interest. I'm not anti-vaccines. We've eliminated smallpox from the world with a vaccine. We've really almost completely eliminated polio, although we're getting some flare-ups now in places with some actually vaccine-related things of polio. We've really reduced, you know, it used to be, you know, people were afraid to go out and let their kids go out to the swimming pool because so many kids would get paralyzed from picking up the polio virus. We don't see that anymore. Nobody even thinks about it. It's sort of passed from our consciousness because polio has been eliminated with the polio vaccines here, at least in the United States and through most of the world. But so I'm not sure what the future is going to show on this one. We're all learning and discovering where this coronavirus is going. But with time, I'm being more skeptical about, coming up with an ideal vaccine solution here.
Well, as they say, an ounce of prevention is better than a pound of cure.
Yeah, interestingly, they came out with a test last week where they had randomly tested a whole bunch of people in New York City. 21% of New York City tested positive in that sample there, which they did at some
That's
supermarkets.
amazing.
Now, if you think about that, that's way, I mean, if you extrapolate that over the city population, I think they said 1.7 million. Well, 1.7 million is way, way more than anybody. In other words, most of those would have had to have had asymptomatic or very minor symptomatology. In other words, basically, a young, healthy human body, even a middle-aged healthy human body, is pretty well geared up to fight this and prevent it from being bad to you. It's really, God really designed our bodies to make it through the history of this world.
Amen.
And I think that's one of the reasons we know he's coming soon, is because we're getting sort of to pushing the limits of what the human body can survive.
Right. Well, time has flown by.
Yeah.
Amazing.
Yeah. I want to encourage you to stay healthy, practice the social distancing, practice wearing your mask, stay tuned to the coronavirus reports, and stay healthy. Encourage one another. Speak positive. Let's help each other. It is true. We are all in this together. We will see you next week. We'll be here. You be here on Coronavirus Report.
Hello, brothers and sisters and friends. The coronavirus has thrown people's lives upside down, and churches are closing for many weeks due to this disease. So Secrets Unsealed has decided to live stream a full-fledged worship service here from our studio, beginning on March 28 and continuing for a period of 8 weeks. We're going to broadcast our program on SUMtv and on social media. So I hope to see you from 10 to 12 Pacific time beginning on March 28th.